Welcome to Global Public Health Podcasts, where we learn from each other about the global and local intersections in health. Hi, I'm your host, Lauren Clark. I'm a professor of nursing at the University of Utah College of Nursing, and I'm bringing to you stories from students with insights into global health. Welcome to the Global Public Health Podcasts. Today we have a guest with us named Sarah Ellis. She spent some time in Honduras, and she really took a great look at cultural accommodation and how, as a nurse in the future, she might be able to appreciate people's cultural values and practices and take those into account as she plans care. As you listen to her podcast, think about cultural accommodation, and that's very different from cultural imposition. Madeline Leininger developed a theory called culture, care, universality, and diversity, and she really encourages nurses to learn about and do a cultural assessment of their patients prior to planning any care. And that would prevent us from imposing our own cultural values as we go forward. So think about that as you listen to Sarah's story.
My name is Sarah Ellis. I am soon to graduate from the College of Nursing, the University of Utah. I hope to go into pediatrics and work in the NICU and help babies. That's my passion. My experience in Honduras definitely taught me to see through new eyes. About 3 years ago, I returned from an LDS mission in Tegucigalpa, Honduras, and it definitely gave me new perspective, and I was able to expand my vision and appreciate a completely different place and culture. One thing that I noticed when I arrived to Honduras were all these beautiful little babies with these big brown eyes, and they each were wearing this red bracelet with 2 big beads on it. And at first I thought it was just, something fashionable or part of their, traditional clothing or something. But each little baby had this and no one else. And I asked one mother why she put one on each of her baby's wrists. She explained that it was to ward off strong or evil looks and that the baby would get sick if someone stared at it too long. At first, I just thought that was pretty unbelievable, and I didn't even know how to respond because it sounded so ridiculous to me, to be honest. But now, in hindsight, I can appreciate that long-standing tradition. If a mother were not to put on a bracelet, it would be as if she were neglecting her child or doing her baby a disservice. I think it's really important to respect the cultural beliefs and traditions in a population and not to just assume that you know how or why they do certain things. Looking back as a public nurse or from this lens, this perspective, if I were to arrive without any, knowledge or without this foundation, I would have maybe just tried to tell them to take off the bracelets and to start, using mosquito nets over their baby's little cribs or making sure that they used filtered water if the baby took a bottle, or talking about maternal health and nutrition. However, it would be so much more effective to, instead of imposing my beliefs and just imposing my culture upon them, rather to build on what they already have, to validate what they're doing, because it really does show that they care about their baby. Because money is so tight and they don't have very many resources, and yet they go and they sacrifice to buy these bracelets and to try to protect their child however they can. Overall, what I learned is that it's not necessary for someone to go to a developing country to develop cultural competence. Really, what it entails is asking questions and not just assuming you know one's beliefs or values. And what it entails is responding in a very loving, very open-minded and non-judgmental way to build rapport with the patient, to gain their trust, and to be able to layer and add onto these just these long-standing traditions. Even the doctors in Honduras bought into this belief that, the strong look or that evil look could make their baby sick. I believe that there's a lot to gain when you lose your ego or when you forfeit biases, judgments, and just appreciate and adopt a new perspective. In 2 weeks, I'll be returning with my husband to Honduras. It's been about 3 years since I've returned home. I could not be more excited. We've collected different medical supplies and raised some money to be able to go down and distribute those resources to different clinics around the country. I'm deeply grateful for what I know now as a soon-to-be nurse so that I can take what I learned in Honduras in order to be effective and hopefully make a difference in the lives of these mothers and their babies.
Sarah talked to us about her experience in Honduras and her pending return to that country. As we think about changes in Latin America over time, it's really very kind of impressive to think about the change in the health risk factors faced by children in Honduras. I just looked this up and came to appreciate that Honduras has made great strides in preventable mortality, particularly for children. Diarrheal disease is down 52% in the last decade, and diarrheal deaths has changed from 6th in ranking to 8th in ranking for causes of death among infants in Honduras. So I have to think about the future. The future for Sarah is bright. She has a nursing career ahead of her, and she's learned about cultural accommodation. And I'm also impressed with and optimistic about the future of health for children in Honduras. With nurses like Sarah and the great strides that the government is making to improve drinking water quality and address diarrheal disease, I'm very optimistic about the future of health for all the children in Honduras. Thanks for tuning in to the Global Health Podcasts, where we learn from each other about the global local intersections in health. I'm Lauren Clark. Thanks for joining us.